very traumatic and can be obviously life-threatening. There's a couple things to keep in mind though with burn injuries that will help you be able to better care for a patient and to better understand really what's going on here. So let's talk about it really quick. So as we said, burn injuries are very severe. This is a child who has experienced burn injuries throughout a large portion of the back. Now a lot of the burn injury and burn kind of research has been done at Parkland Hospital here in Dallas, Texas. And it's actually right down the street from where I live, so it's really neat that an innovator in burn and in burn care and in burn injuries is so close to where I am. However, unfortunately, because Parkland is such a huge burn center and burn hospital, they have a Trauma 1 burn ICU specifically dedicated to burn patients. I don't see a lot of these burn injuries because they all go to the burn ICU, okay? So when we talk about burn injuries, one of the first things to keep in mind is assessment, okay? Always with nursing, we're talking about ADPI, right? And the A in ADPI is assessment. Okay, so with assessing burn injuries, we have what's called the rule of nines. And what the rule of nines talks about is it talks about how to evaluate how much of a patient has been burned. Okay, and so you see from this image here, the head and neck count for about 9%. Upper limbs count for about 9%. The trunk counts for about 36%, okay? And that, of course, also is a multiple of 9. Genitalia would count as 1%. Lower limbs count for 18% each. Okay, so what this does is it gives us a really quick tool to be able to say, okay, they've burned about 36% of their body, or they burned 18% of their body. And so it gives us a way to kind of break the body down into different portions and tell us how much of the patient has been burned, which allows for quick assessment and quick care, okay? So that's rule of nines. That's one thing you need to keep in mind very quickly. You may even get a question that says both upper limbs have been burned. How much, according to rule of nines, how much of the patient has been burned? Okay, well, upper limbs are 9% each, so that would be 18% if both upper limbs were burned, okay? So that's what the rule of nines is helpful for. It's helpful for assessment, and then it's also helpful because you can quickly answer questions based on that. So therapeutic management for a patient who's experienced a burn. Again, a lot of the fluid resuscitation, there's several big theories about fluid resuscitation. One of those is the Parkland, as we talked about earlier. But fluid resuscitation and infection prevention are the primary goals with these patients. These patients have lost their skin, and skin plays two very important roles. Skin is our primary preventer for infection, and it's our primary temperature regulator. Okay, so once we lose that, we're at a huge risk for infection, and we have very little ability to regulate temperature. Okay, and then the patient is also going to need a lot of fluid. So as they're burned, they lose a lot of this fluid. And so what we do is we actually are titrating our fluids, where with like cardiac patients, we're titrating to cardiac output or to a wedge pressure or to a heart rate or blood pressure or whatever. With burn patients, we're actually titrating to urine output. We're trying to titrate our monitoring fluid out or urine output, and we're titrating our fluid administration to urine output of about 30 to 50 mils an hour. We're also providing very high calorie foods. These burn patients are going to require a tremendous amount of calories to replenish and to support all the healing that they're going to have to go through. Okay, so those are the big things there. We're also going to assess for edema, because a huge problem with these patients is going to be third spacing, where fluid goes into unusable intravascular space and we're not able to use it, okay? So we're going to monitor for that edema and monitor for fluid shifts and try to keep that fluid usable and circulating, okay, for our body. And then one other thing we're going to do for these patients is skin grafting. We can take skin from donor patients, or we can use it from other areas on a patient and provide a skin graft for the patient. Okay, so this is a picture of a skin graft. You can see here's a burn on a patient, and then what happens is this is like the skin graft here. It's kind of this, it almost looks kind of like a mesh. They make the skin into a mesh, stretchable, and it goes on the patient, and then this will grow over and heal. And you've probably seen someone who's had a skin graft before, who's had major injury years later. I mean, this isn't going to grow over perfectly, but it provides the covering and the protection that they need, and it becomes viable tissue. Okay, So that's kind of what happens with a burn injury. Again, the big things you want to keep in mind here are the rule of nines. You want to keep in fluid resuscitation, infection, and temperature. Those are going to be your 3 core things to keep in mind here, okay? And then we're monitoring urine output, trying to get it to a normal state with our fluid administration, and making sure we don't go into like third spacing or anything like that. All right, so that's really kind of what you need to know. And again, especially with our skin graft patients, we're watching infection, we're watching for host rejection. We want to make sure that the patient, and this is our graft, so we don't want any graft versus host or anything. We want our patient to accept this tissue. We want it to work, so we may be giving them immunosuppressants as well. All right, so that's kind of how we're going to manage these patients who experience burn injuries. If you have any questions, as